Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist and I practice in the Triangle area of North Carolina. This is a video series called Obesity Medicine Perspective. Our last two videos really, we were talking briefly about metformin and how metformin, the drug metformin, can lower your serum insulin level. Prior to that, we had been talking about insulin being a fat storage hormone. So I want to continue to build on this theme and stay on it because it remains the biggest problem I see in my practice. So the American diet, in large part, in my lifetime, has been built around the over-ingestion of carbohydrate. Carbohydrates are turned to blood sugar, and when your blood sugar is elevated, your pancreas has to make insulin to control it. And the amount of insulin that most Americans are making is much larger than the amount our ancestors made. So when you think back a few thousand years, our ancestors did not have the capacity to refine grains. They didn't have sugar. They didn't have, as I say, the middle aisles of the grocery store that we have today. So the kind of foods they would eat consisted primarily of animal products and vegetables. And those things really don't have the capacity to raise your blood sugar to any appreciable amount. And so the amount of insulin that they required was just a very small amount. And this is the way that the human body was intended to function, with just a small amount of insulin, very small rises in your blood sugar, very small rises in your insulin. And because insulin's a fat storage hormone, they didn't have a large fat storage signal, and those individuals were very, very lean, and weight was not a problem, and this excess body fat was not a problem. But in our American society, it has become a real problem because our diet really has changed over the last 100 years, and now we eat a ton of carbohydrate compared to what they ate, and in many cases it's very quickly digested, and so the blood sugar rises precipitously, the insulin level rises precipitously. This happens again and again every day, and so over a lifetime this high insulin level is constantly sending this fat storage signal, and we as a nation are the largest individuals that have ever existed on this planet. We have more fat than any other nation that's ever existed on this planet. So I wanted to give you a picture of that would drive home this point that you can remember to help illustrate what insulin is all about. So I took a slide from a recent presentation I was at. I am a member of the American Society of Bariatric Physicians. It's the main group of doctors in our country that do what I do, that practice obesity medicine, and there's a twice-a-year conference where continuing medical education is presented. And so the most recent conference was in Denver in the spring, and I was there, and a doctor from Duke University, very famous doctor named Eric Westman, who lectures on this subject frequently, gave a lecture on the history of the treatment of type 2 diabetes. And this is important because it involves this insulin issue, and there was a picture in one of his slides that illustrated this point, and I copied this off so that you could see it. So as a background, type 2 diabetes, or adult onset diabetes, results in individuals who have made this large amount of insulin their entire life, and the insulin level in fact is so high that your cells begin to tune it out. It's like the boy who cried wolf. They just stop listening to the insulin, and we call this insulin resistance. Well, when that happens, you lose your ability to control your blood sugar, and you then get type 2 diabetes. And because of this large amount of insulin sending a fat storage signal, all of these individuals are overweight. And that's usually the way that we think about diabetes. We're usually making reference to adult onset or type 2 diabetes. But there's another type. It's called type 1 diabetes. And this happens to children. They're born with a pancreas that cannot make insulin. So they have no ability to have a fat storage signal. Now these individuals are hungry all the time. Their insulin doesn't work. They can't store a single thing. So they can eat a meal, but they have no capacity to store a meal, and because they can't make insulin. So unlike the adult diabetic, they have no insulin and they can't store any fat. So when you make the diagnosis on these children, they are extremely thin. And this picture illustrates that. So here in the picture, I have a child who looks like they got out of a concentration camp here, And that is the child at diagnosis with type 1 diabetes, no insulin. This same child was treated for 4 months with insulin, and there's the child there after 4 months of treatment. You can see how much weight and fat that child has gained. And that illustrates exactly what insulin does. It makes you gain weight and it makes you gain fat. And if you can imagine adults in the United States eating a large amount of carbohydrate, having surges in their blood sugar, a lot of insulin over a lifetime, it's a constant fat storage signal, and it's like that same case magnified on a much larger scale. And that's a great way to remember it. So, if you want to know more about this, we'd love to have you as a patient if you're not a patient. If you have not been in a while and you want to come back and get restarted, we'd love to help you. We want you to follow us on our Facebook page and on our Twitter feed and on this YouTube channel. And if you'll do that, we're giving away free InBody 770 body composition analysis test. This test is worth $40. It's a very accurate test that tells you what your body composition is. So please follow us on our social sites, and until we talk the next time, I'll give you the tools, you give me the effort, and together we can overcome obesity.